Welcome to This Week in Allergy and Immunology. This week we're covering 9 notable papers spanning advances in asthma and COPD management, new frontiers in allergy prevention and treatment, and a look at emerging concepts from post-COVID syndromes to rare diseases. Let's dive in. Our first theme focuses on chronic airway diseases, with new insights into phenotyping asthma and the role of biologics in both asthma and COPD. We often think of obese asthma as a single entity, but a study in the Journal of Allergy and Clinical Immunology in Practice suggests it is far more heterogeneous. Researchers from the Australasian Severe Asthma Network analyzed 244 subjects with obese asthma, not just based on BMI, but using a more nuanced definition of obesity from the European Association for the Study of Obesity. Results: a hierarchical cluster analysis identified 3 distinct subtypes. Cluster 1 was described as younger, mild obese asthma with high skeletal muscle mass. Cluster 2 was a male smokers predominant uncontrolled group with multimorbidity and eosinophilic inflammation. And Cluster 3 was an older, female, non-smokers predominant group with high visceral fat and neutrophilic inflammation. The clinical implications were significant. Clusters 2 and 3 had a much higher risk of moderate to severe exacerbations, more than 5 times the risk for Cluster 2, and nearly 4 times the risk for Cluster 3. They were also far less likely to achieve clinical remission. A decision tree analysis validated these clusters with high accuracy, suggesting that phenotyping obese asthma could lead to more targeted and effective management. Staying with asthma, a common clinical question is whether to escalate inhaled corticosteroid, or ICS, dose, or to add a biologic. A post-hoc analysis of the QUEST study, Asthma and Immunology, provides some compelling data. The study. This analysis compared patients with uncontrolled, moderate to severe type 2 asthma who received dupilumab plus a medium-dose ICS against those who received a placebo plus a high-dose ICS. The population included over 1,500 patients with baseline eosinophils of at least 150 cells per microliter or an exhaled nitric oxide level of at least 20 parts per billion. Results? The findings strongly favored the add-on biologic strategy. Adding dupilumab to a medium-dose ICS reduced severe exacerbations by 70% compared to escalating to a high-dose ICS with placebo. Furthermore, the dupilumab group saw a significant improvement in pre-bronchodilator FEV1 of 0.22 liters and had more than double the odds of achieving asthma control. While the authors caution that this was a post-hoc analysis and not a head-to-head trial design, the results suggest that for patients with uncontrolled type 2 asthma, adding dupilumab may be a superior strategy to simply increasing the ICS dose. This warrants future prospective studies. Rounding out our airway disease theme is a look at COPD-2 large trials. The Phase 2b Aliento and Phase 3 ARNASA trials investigated astegolimab, an antibody targeting the ST2 receptor for patients with COPD and a history of frequent exacerbations. The ST2/IL-33 pathway is implicated in both eosinophilic and neutrophilic inflammation, making it an attractive target in a heterogeneous disease like COPD. Results. The results were mixed. In the Aliento trial, astegolimab given every 2 weeks was associated with a 15% reduction in the rate of moderate or severe exacerbations compared to placebo, a finding that was statistically significant, albeit barely. However, the every 4-week dose in Aliento was not effective. In the larger ARNASA trial, neither dosing regimen met statistical significance for the primary endpoint, though the every 4-week dose showed a trend toward an 18% reduction. Safety profiles were balanced across all groups. The takeaway is that targeting the ST2/IL-33 pathway shows a signal for reducing COPD exacerbations, but the inconsistent results across 2 pivotal trials mean its role is not yet clearly defined. It suggests a potential benefit for a patient group with limited options, but more work is needed. Our second theme explores evolving strategies in allergy, moving beyond simple avoidance toward active prevention and more sophisticated management. A key question in our field is whether we can prevent allergies from developing in the first place. A randomized trial in the journal Allergy provides a hopeful signal. Investigators studied the preventive application of house dust mite sublingual immunotherapy, or SLIT, in 33 sensitized but asymptomatic preschool children aged 3 to 5 years. Children received either HD-MSLIT or a placebo for 2 years. Primary outcome. The primary goal was to see if SIT induced allergen-specific blocking antibodies. Indeed, the treatment group showed a significant increase in DIR-P1-specific IgG levels by the end of treatment. This was accompanied by other positive immunomodulatory effects, reduced skin prick test, and basophil reactivity to the allergen, no long-term increase in specific IgE levels, and a blunting of new sensitizations. The sera from treated children could also block basophil activation. These findings suggest that preventative SLIT in high-risk asymptomatic children can induce key immunologic changes that may interfere with the progression to clinical allergy. For patients with established food allergies, oral immunotherapy, or OIT, is an increasingly used treatment. A review in the Annals of Allergy, Asthma, and Immunology explores the unintended consequences and clinical considerations of OIT, specifically its effects on nutrition, growth, and the microbiome. Strict avoidance, especially of nutrient-dense foods like milk and egg, can compromise a child's diet. OIT offers a chance to reintroduce these foods, potentially improving nutrient intake. However, the review highlights a key risk: the reliance on energy-dense or ultra-processed foods to mask the allergen during dosing, which can lead to excessive calorie intake and poor diet quality. Regarding growth, outcomes during OIT appear generally favorable, especially in younger children. The impact on the gut microbiome seems modest and variable, with changes being more specific to certain taxa rather than a global shift. The article stresses the need for multidisciplinary care to balance the immunological benefits of OIT with its nutritional risks. Also on the topic of food allergy, a qualitative study in the Annals of Allergy, Asthma, and Immunology explored patient and caregiver perspectives on precautionary allergen labeling, or PAL, in the United States. These may contain statements are currently unregulated and a major source of confusion. Through interviews with 20 participants, researchers found a strong desire for a clear, standardized, and evidence-based PAL system. Participants were generally supportive of incorporating allergen thresholds, like the Vital Program's ED05, which represents the dose that would elicit a reaction in 5% of the allergic population. A two-level PAL system was favored, where products with allergen levels below the ED05 threshold could either have no label or a low-risk statement. However, the study notes that global regulatory bodies have hesitated to endorse such a system, fearing misuse by manufacturers. This paper underscores the gap between patient needs and current policy, highlighting the need for consensus among all stakeholders. Our final theme covers a range of emerging topics: the long-term allergic consequences of COVID-19, new guidance for rare immunodeficiencies, and innovations in diagnostics. A large propensity-matched cohort study in the Annals of Allergy, Asthma, and Immunology adds to the growing evidence that COVID-19 infection can trigger allergic diseases. The study followed individuals aged 1 to 64 for up to 18 months post-infection. The results were striking. In the full cohort, a prior COVID-19 infection was associated with a significantly increased hazard for developing all 6 allergic conditions studied: atopic dermatitis, asthma, food allergies, rhinoconjunctivitis, medication allergies, and urticaria. In a sub-analysis of children, the risk was elevated for all conditions except food allergies. These findings point to a potential post-infectious Th2-skewed immune response and highlight a significant public health burden. Clinicians should maintain a high index of suspicion for new-onset allergic diseases in patients who have recovered from COVID-19. For clinicians managing patients with very rare diseases, A new international consensus statement in the Journal of Allergy and Clinical Immunology provides much-needed guidance on using JAK inhibitors for inborn errors of immunity associated with gain-of-function mutations in the JAK-STAT pathway. These conditions cause severe immune dysregulation, but no JAK inhibitors are officially licensed for them, leading to widespread off-label use without clear guidelines. An international expert group, using a systematic review and a modified Delphi approach, established 51 consensus statements. The guidance covers 5 key areas: indications and contraindications for JAK inhibitors, pretreatment assessment, pharmacology and dosing, monitoring during treatment, and use in the context of hematopoietic stem cell transplantation. This document represents the current international standard of care, synthesizing the best available evidence and expert experience for this challenging patient population. Finally, a review in the Journal of Allergy and Clinical Immunology in Practice looks beyond the endoscope for diagnosing and monitoring eosinophilic gastrointestinal diseases, or EGIDs, particularly eosinophilic esophagitis. The current standard of care requires repeated esophagogastroduodenoscopy, or EGD, with biopsies, which is burdensome and costly. The article reviews several less invasive alternatives. These include unsedated transnasal endoscopy, the esophageal string test, and sponge-based devices, all of which can sample the esophagus without full sedation. It also discusses complementary tools like impedance PL anemetry to assess esophageal distensibility and the future potential of non-invasive biomarkers and microbiome analysis. These innovations promise to make the long-term management of EOE much easier for patients. If you only have time for one paper this week, make it the post-hoc analysis of the QUEST study in the Annals of Allergy, Asthma, and Immunology. It directly addresses a frequent clinical decision point in managing uncontrolled type 2 asthma: escalate ICS or add a biologic. The data strongly suggests that adding dupilumab to a medium-dose ICS is superior to escalating to a high-dose ICS for reducing exacerbations and improving lung function. Here are the key takeaways from this week in Allergy and Immunology. First, for patients with uncontrolled moderate to severe type 2 asthma on medium-dose ICS, consider adding a biologic like dupilumab before simply escalating to a high-dose ICS. Post-hoc data suggests this leads to significantly better outcomes. Second, stay vigilant for new-onset allergic conditions, including asthma, atopic dermatitis, and rhinoconjunctivitis in both children and adults following a COVID-19 infection. The risk appears to be significantly increased. Third, preventative immunotherapy is a promising frontier. A new trial shows that house dust mites in sensitized but asymptomatic preschoolers, induces blocking antibodies, and reduces effector cell responses, potentially altering the course of allergic disease development. Fourth, obese asthma is not a monolith. Phenotyping can identify high-risk clusters, such as those with eosinophilic inflammation and multimorbidity, or those with neutrophilic inflammation and high visceral fat, who have worse outcomes and may require more targeted therapy. Finally, for rare diseases, new international consensus guidelines are now available to direct the off-label use of JAK inhibitors in patients with JAK-STAT gain-of-function inborn errors of immunity, standardizing care for this complex group. That's your roundup for this week in Allergy and Immunology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week.